Start the vessels. Here, this part is heart, and you can see the ascending aorta and arc aorta and descending aorta in this area. In the arc, we have three great vessels here. The first is the brachiocephalic, and the next one is the left carotid and the left subclavian. And brachiocephalic divided in the cervical area in the two parts. That's a right carotid and right subclavian. The subclavian artery goes to the upper limb and blood supply the upper limb. At first, the subclavian continue until the lateral border of the first rib. After that, they change the name and we say the axillary. The axillary continue until the lower border of the teres major, and after that we say brachialis. Here is a brachialis. The brachialis in a elbow divided two artery. In the lateral is radial, and in the medial is ulnar, and ulnar in the palmar surface make a superficial palmar arc, and after that you can see here the proper palmar, is a common palmar artery and proper palmar digital. That's a common palmar digital and proper palmar digital, and here is another branch. Okay, but the radial goes to the posterior, and you can see here, and in the posterior you can see a arc, the dorsal carpal arc, and some branches separated from the arc to blood supply the fingers. Okay, that's in totally I explain for you, and in this here is in an axilla, okay? In this that's a subscapular muscle, and you can see the subscapularis. You know the subscapular artery. The subscapular artery have branches for the blood supply of the subscapularis muscle, and one branches go to the posterior. In this branches go to posterior, and this is the circumflex scapular. The circumflex scapular exit from the triangular space. Another branches from the axillary artery is a posterior circumflex scapular. The posterior circumflex scapular, along with the axillary nerve, exit from the quadrangular space. Here is a quadrangular space to blood supply this area. But another branches from after that they change the name. This is a brachial artery. The brachial artery is come here, and in the elbow divided to the here is a radial and ulnar artery, okay? But the branches separated from the brachial and goes to the posterior along with the radial nerve is a profunda brachii. The profunda brachii have two branches. One branch is here and another in the lateral part, okay? Lateral, if you look here, it's a lateral because that's a thumb, and that's a radial collateral. Sorry, this is a medial collateral and lateral. That's a radial collateral. Medial collateral and lateral collateral branches out from that separate from the profunda brachii. Okay, we review it again. Here is the branches of the subscapular. This branches goes to the posterior circumflex scapular. This branches is a posterior circumflex scapular. This branches along with the radial nerve is profunda brachii, and have two branches. This branch is in the lateral, is the radial collateral and medial collateral. Okay. This is a radial, this is a brachial artery. These branches that's along with the ulnar nerve that pass from the posterior medial epicondyle is superior ulnar collateral. Superior ulnar collateral. And that's a brachial artery. And in this area you can see the two branches. This is a radial. The radial goes like this. This is the pathway of the artery. And this one is the ulnar. The ulnar artery and ulnar nerve. In this model, that's a brachial and that's a superior ulnar collateral. The brachial have two branches. This is radial artery. The radial artery come here in the front of the inferior lower. Let's say the inferior part of the forearm is the lower end of the radial, and you can take a pulse here. And after that, the radial artery turn around the radial and goes to the snapbox, and after that pass from this tendon of extensor carpi, extensor crucis longus, and you can see here perforate this area and goes to the palmar surface. Okay. So this is a radial artery, and this branch is a superficial palmar branch. Here is the ulnar artery. The ulnar artery have important branches here. That's a common interosseous. The common interosseous is so small here. Okay, it's a common and divided into two branches. This branch is in anterior, is the anterior interosseous, along with the anterior interosseous nerve. And the posterior, this is the posterior, goes to the posterior. And exit from the inferior border of the supinator, along with the posterior interosseous nerve. The nerve and artery the name is alike or the similar. Okay. Here the artery come down, and here is the Guyan canal, this area, and this nerve is the ulnar nerve, and the both enter to the palmar surface. And the ulnar make arc here and complete with the palmar surface. Palmar, the superficial palmar branches of the radial and make a superficial palmar arc. You can see that the main trunk of the arc formed by the ulnar. This is a superficial palmar arc. The superficial palmar arc have three branches. There's a common palmar digital until the base of the fingers, and after that divide to the proper palmar digital. So here is a proper palmar digital, and here is proper palmar digital. For the little finger, for the medial surface of the little finger, directly separated, this is a proper. Proper means goes directly to the fingers. Here goes to the fingers, we say the proper. The common means that divide to two proper. Because this branches directly goes to the finger, we say the proper palmar digital. So we have a proper palmar digital, this is common palmar digital. Okay. The ulnar artery and nerve have a dorsal branches. Okay, the dorsal branch of the ulnar. the dorsal branches of the ulnar nerve and artery. The both are the same. And here, make an arc here is a dorsal carpal arc. We review again. The ulnar artery have a common interosseous, anterior interosseous, posterior interosseous, and posterior. This area is an extensor compartment here. Okay. This branch is here for the look here. It's the ulnar and radial. The radial have a superficial palmar. This is superficial palmar. They both make a superficial palmar arc. If we remove this part, and you can see a deep branch of the ulnar. The deep branch, because here, okay, here separated and goes to the deep part and complete with the radial artery and make a deep palmar arc. So we have a two arc in a palmar surface. The superficial is superficial to the tendons, and deep the tendons, and on the interosseous we have just a deep palmar arc. Okay. We come back to the here you can see the branches of the dorsal carpal, the dorsal branches of the ulnar. Here is a common palmar, this is superficial palmar arc, and here is a deep palmar arc. And these branches that separated from the radial is superficial palmar branches. Okay. We continue the radial. Okay, this is the radial artery. The radial artery goes to the dorsal surface. Okay, that's here is a abductor pollicis longus and extensor pollicis brevis, and after pass from the inferior surface, enter to the snuff box. In a snuff box, you can see a branches for dorsal carpal. I have told you this is dorsal branch of the ulnar, and here is the dorsal carpal. Make a dorsal carpal arc. The dorsal carpal arc have a dorsal carpal until the base of the fingers, and here this is a dorsal digital. So dorsal carpal and dorsal digital until the base of the middle flanks. Here, this is a dorsal arc. This is second, third, and fourth dorsal metacarpal. Okay, here is a dorsal metacarpal. The first dorsal metacarpal, second, third, fifth, and fourth and fifth. Okay. After that, here is a dorsal digital. Okay. And finally, this is radial artery penetrate the interosseous, and between the interosseous and adductor divided the two branches. Here, okay, this is the adductor, and here is dorsal interosseous. These branches goes to the princeps pollicis, goes to the pollex or thumb, and here for the lateral surface of the index is radialis indicis. And after that, you can see the continue of the radial come to the palmar surface and complete with the deep branch of the ulnar and make a deep palmar arc. The deep palmar arc have a three palmar metacarpal. Here is a palmar metacarpal, and finally the palmar metacarpal joined to the common palmar digital in the base of the finger. Okay, we review again. radial. This branches is a superficial palmar branches. Here is a snuff box. This is the first dorsal metacarpal. This is a dorsal carpal. Second, third, fifth, and fourth and fifth dorsal metacarpal, and in the base of the finger to the two dorsal digital. The dorsal metacarpal and dorsal digital. The dorsal digital continue until the until the medial phalanx.